Go ahead and state your name, your position, and where you're from.
Hi, I'm Svetlana Steltsova-Verma. I'm a patient care director for the pediatric cardiac ICU and the cardiac NICU at Morgan Stanley's Children's Hospital, and I have 20 years of pediatric cardiac ICU experience.
Awesome. So is this your first mission?
This is my very first mission.
Awesome. And what were your expectations when you were leaving the U.S. to come to Nigeria?
I don't know what I fully expected, but I thought that it's going to be a very rundown facility. I thought supplies and accommodations are going to be a little bit rough. Almost, I envision, unfortunately, like a hut situation or kind of a makeshift kind of hospital under tents, things like that. Not sure, because it was a first mission and not knowing what is in the country and what kind of supplies are there, even like beds, sheets, pillows. I was planning on sleeping on floors and like using my own clothes as like covers kind of thing. And I couldn't even wrap my mind around what there would be for the kids after surgery, other than what we had on our list of medical supplies to bring for them. So that is what I was anticipating, everything that we had on the list, and we would just have to makeshift tubing, interventions, lines, whatever need be. I thought that we would have to make kind of on the fly.
Awesome. So having said all that, and after you arrived and saw the facility, then what was your expectation or your realization, I guess?
Sure. I was profoundly impressed. Just walking into the hospital, it gave me a feeling of a community hospital that we have in the United States. They had the right accommodations, beds, pumps, monitors. Some of the infusion pumps are even a little bit more advanced than what we use in our own organization. So I was like, this is like being at home. Like just a different home, and our own personal medical accommodations were phenomenal. The amenities that we had in our rooms, our beds, our pillows, food and snacks and beverages in the fridges, as well as just the hospital and the care for the patients. It was very easy for my nursing team to come in, to set up the beds, to really create an ICU environment that we would mimic in our own home. And I think within a couple of hours, when we walked into this ICU, it felt like we were walking into our own unit, knowing where all the supplies are, syringes, gauzes, tapes, medications, created relationships with pharmacy, created relationships with laboratory, blood bank. We, like within the first several hours of stepping on ground, we kind of knew the flow of this organization, which is brilliant. And it's a true testament to how much work was put in by this organization, by VOOM and the folks here on the ground, to make it as comprehensive and easy flowing and family feel for everyone to know how every system works from admission to discharge.
Awesome. What, from your experience on this trip, what would you say is the biggest challenge for you and your team?
I think the challenges were very little, very trivial. Running out of supplies, not knowing where to get additional ones, but then finding out that there are, and kind of trying to work around thinking we don't have additional items to do certain work or interventions, and we just needed to learn that we have to ask the question. We are so used to having things at our fingertips, working in a very large university institution, but we just had to learn that if you ask the right people, they will give you what you need. and not having as many staff members that we're used to. We are used to having kids like one-on-one or two-on-one, particularly when they're coming back from the OR, we're one-to-one, and we had to double up on assignments. So that is something that we needed to reconcile. We have the strength, the knowledge, the skills, but being in a foreign kind of environment and multitasking to a level that we may not be used to on a daily basis, that was a little bit challenging, but we made it through. Within that same shift, if you will, that we were working, we already figured out how to work around it, and we kind of created a schedule of nurses and support nurses to have. We brought in the local team, which was really, really helpful, and they were able to do certain interventions to support us, to help us, and look out for the kids that we weren't able to monitor at that moment. So that was very helpful. So really no significant challenges other than little supply things, food, feeding kids. That's something that we didn't appreciate coming here, thinking that they're getting breakfast, lunch, and dinner as we do in the hospital. And nutrition is healing. And we appreciate it right away. As soon as they're not on a breathing tube and they're drinking, they're gonna escalate to eating normal food. And that's what we didn't have immediately for them. Something that the kids like to eat on a regular basis, and food that they're used to, we didn't have initially. But as the days went on, we had food being delivered to them, and we kind of normalized again. So that's something that I wish we anticipated ahead of time. Little snacks like jellos and puddings and cereals, juices, juice cups with straws, because it's hard to drink from cups. Straws is something that we moved away from the United States, but we really needed it in a post-operative setting.
Mm-hmm. How do you feel your team, your nursing team, and then also just your team from New York that came here, how do you feel like you guys grew?
Oh my goodness. I feel like these 2 weeks were years of nursing experience. And we talked about it every single morning, every single night, that this is true nursing care. Without the red tape, the bureaucracy, regulatory commissions and things like that. What we were doing was hardcore, fundamental nursing care, fundamental ICU nursing care. And we appreciated how much knowledge and strength we have, because we rely too much on resources. You don't know the answer, and you're quickly on an infinite and getting all the answers, or you have pharmacy there at your bedside, drawing up meds, reconstituting meds. Those are things that we had to do at the moment as nurses. And because we have that level of experience, we brought some resources with us, sheets that we printed out. We did everything that others normally do for us, drawing up medications, appreciating our knowledge and skills in medication calculations, how to reconstitute meds. This was truly hardcore nursing at its best. And I look at them, and I've been telling them, you guys are like the Navy SEALs of nursing. We come in, we fix, we make better, we clean up, and we leave. And I'm so proud of them. I can't tell you, I'm gonna start crying. I can't tell you how proud I am of the team, and I can't tell you how grateful I am for this experience. I feel like my stars aligned. And as I told you before, I think this was like February that Dr. Goldstone reached out to me, and like surgeons really don't call the nursing supervisor, like the head nurse, for just random things other than to complain about something was left out, something was not properly done for their patient. But he called me and he started talking to me about this mission. I'm like, oh my goodness, like I'm all grown up now, my kids are big. I'm like, this sounds interesting. I'm like, so what do you need from me, Dr. Goldstone? He's like, I need nurses. And I'm like, I have your nurses. And I wish I could have brought so many more nurses, but of course there's sick kids in the United States that needs our team. Staffing is an issue, but I'm grateful for the 7 of us that were able to come to make a difference in the 11 patients that we've done surgery on, which was absolutely brilliant. To do 12 surgeries on 11 patients, to do surgery on a beautiful little boy back to back within less than 24 hours, to take him back to surgery and have him walk out of here perfect, eating, walking independently, you know, playing around, laughing, doing all the normal things that he likes to do is just a gift. It's just a gift, and it's a true testament to how hard everyone works to bring wellness to these kids.
Awesome. Last question. Will you be coming back?
100%. 100%. I wish I could come back more often, but I do have
Life.
I do have life. I do have a family. I have 2 beautiful kids, a husband, and I have a really significant work responsibility in the hospital. I oversee over 140 nurses in 2 very highly acute cardiac ICUs. So there's work to be done at home. But for sure, I will be back here next year, and for sure, more nurses to experience the blessing I was gifted from this mission.
Last couple of things. What do you want to say to the sponsors that sponsored all of these children's surgeries?
Thank you. Thank you. I'm grateful, and they are grateful. You completely changed their lives. They're going to have a full, well life, and it's only because of you. And we had a couple of emergencies coming into surgery, and if these kids were not in our hands at that moment, like heaven sent, the outcome would have been so much different for them. So we're grateful. So thank you so much.
Can you expand a little bit on the emergency that you had?
Sure. So kids with tetralogy of Fallot, they have what's called TET spells, and they get profoundly hypoxic, meaning they don't have enough oxygenation and they faint. So there was one little girl who had an episode upstairs where we kind of
This was before she was prepped for surgery. Right?
Yeah, and she had a TED spell, and they rushed her down. They rushed her down from a general ward into the ICU, and then she awoke. And that process of keeping her knee to chest kind of helped regulate the flow of blood and oxygenate her, and she awoke. And luckily, she went to surgery and recovered, and now she's home. The same thing happened with another young lady, and it was in the middle of the night, but her spell was so profound that they had to put in a breathing tube emergently in the middle of the night, and then rushed her to surgery the next morning. She's still on a breathing machine, but waking up, fighting us, very, very appropriate, and we're really hoping to take her off the breathing machine today, and she's going to do very well. Her heart is good. Her heart is good. We just needed to support her respiratory-wise a little bit longer, and she should have a full recovery. But the second girl, if she wasn't in a medical setting or an ICU setting where they could put in a breathing tube, she would have passed away for sure.
Awesome. Thank you for everything you've done.
Thank you.
Amazing.
Thank you.